This is Tom. He's 70 years old. In the last months, he was facing more and more health problems. He has tremors in his hands, arms, and legs. He has difficulties initiating movements, and he has bradykinesia. His doctor diagnosed him with Parkinson's disease. Doctor says that this is caused by a cell death of dopaminergic neurons in the basal ganglia. He's totally confused. The basal ganglia play a role in the cognitive function and memory, as well as in the coordination of movements. We will now repeat the anatomy of the basal ganglia. What we can see here in light blue is the caudate nucleus and the putamen. Together they are summarized as the striatum. In orange we can see the thalamus. In dark green we can see the external segment of the globus pallidus, and in light green we can see the internal segment of the globus pallidus. In red below we can see the subthalamic nucleus, and in purple we can see the substantia nigra. In the basal ganglia there are many pathways and interconnections. I'm going to explain now the most important. The direct pathway is for making movements, and the indirect pathway is for inhibiting movements. To understand the basal ganglia, it's really important to always keep in mind that under normal conditions, the internal globus pallidus inhibits the thalamus by the neurotransmitter GABA. The neurotransmitters used in the basal ganglia loop are glutamate, which has an activating function, GABA, which has an inhibiting function, and dopamine, which can have an activating and inhibiting function. The direct pathway is responsible for making movements. A movement starts in the motor cortex with the thought, "Hey, I want to move." The motor cortex then excites the striatum via the neurotransmitter glutamate. The striatum then inhibits the internal globus. As I said before, the normal situation is that the internal globus pallidus inhibits the thalamus. But just imagine the internal globus pallidus, which is responsible for the inhibition, is now itself inhibited. That means it acts less inhibitory on the thalamus. So the thalamic neurons can excite the motor cortex. And the motor cortex can then send excitatory information to the muscles. The substantia nigra has an effect on the neurons between the striatum and the internal globus pallidus. Through the release of dopamine, it has an activating effect on the inhibition of the internal globus pallidus. The function of the indirect pathway is to inhibit movement. The motor cortex excites via glutamate the striatum. The striatum inhibits via GABA the external globus pallidus. The external globus pallidus inhibits via GABA the subthalamic nucleus. The subthalamic nucleus activates the internal globus pallidus, which then inhibits the thalamus. Since no excitatory signals can leave the thalamus, no muscle movement is performed. Dopamine release from the substantia nigra supports the inhibition of the external globus pallidus by the striatum. Parkinson's disease is caused by the death of dopaminergic neurons, which originate from the substantia nigra. Let's have another look on how the substantia nigra influences the direct and the indirect pathway. The substantia nigra has an activating effect on the direct pathway. In pathologic conditions, this may cause failure of the patient to initiate movements. Under physiological conditions, the substantia nigra has an inhibition effect on the indirect pathway. But due to the death of the dopaminergic neurons, this inhibition effect is not there. So the loss of the nigrostriatal dopaminergic pathway upsets the fine balance of excitation and inhibition in the basal ganglia. So which drugs can we use in order to treat patients with Parkinson's disease? A very commonly used drug is levodopa because it can cross the blood-brain barrier. Another treatment would be the usage of dopamine agonists. They just sit on the receptor and have the same effect as dopamine. We can also use a drug which inhibits the monoamino oxidase B. So the enzyme that normally breaks down the dopamine is then inhibited. So back to Tom. He wants to make the best out of the situation and takes his drugs against Parkinson regularly. He wants to enjoy the time with his grandchildren, keep himself fit as long as possible, as well as seeing a physiotherapist.